I think that I think everybody is waiting on the room. We are still always letting a couple or minutes before starting the presentation, just to let the time for everybody to join the webinar. We are seeing the number increasing and increasing of all the participants that are there. Would like to thank you very much. Thank you everybody that are taking a little bit of time to connect on what is an afternoon, a late afternoon for some of you, an early morning for some others, and just the beginning of the afternoon for the rest of you. We are very fortunate to have people that connected from more than 43 countries, which is always such a great feeling to know that we are followed in so many different places in the world. Just to explain you a little bit how is the webinar of today is going to take place. We are about to start in a little bit less than a couple minutes. We're going to have 45 minutes of lectures of Dr. Zarampour that I will explain you more about in a couple minutes. But just to say, 40 minutes, 45 more or less of lectures on the theme that you know of the froggy mouth use on eyeliner treatments. And then we're going to have 15 minutes of question and answer session. So during the whole webinar, you're going to have the chat to discuss with you, for example, and the Q&A session dedicated in Zoom to ask all your questions. I'm gonna just pick the best one, the most interesting ones, the ones that received the biggest amounts of votes, because you can vote on the Q&A part for the questions that you want me to ask to Dr. Zarampour directly at the end of the webinar. And we should be done in a little bit more than an hour. So now that most of you already are connected, let me introduce you a little bit Dr. Zarampour, that is a great practitioner, but a friend before all. So that's why I am so glad to be able to welcome it. And I'm so glad to be between two French people speaking in English together. As you know, the legend says that only French people understand when another French people is speaking in English. So we will try to make this legend lie today. So for the ones who do not know him, Dr. Zarampour is an expert in interdisciplinary and holistic approach of orthodontics. That's really what personally made me becoming such a big fan of his approach. When I have a question, I really share an honest feeling saying that, but when I have a question on my own teeth, Arash Zarampour is actually the person that I am calling to ask her this question. We are used to present you many practitioners, but that's one of the reasons why I'm having a special relationship with Arash. He's mostly known worldwide for his aligner work because he co-developed the Smilers orthodontic aligner system that many of you already know, that is sold by the Smiler company and the Biotech Dental Ortho company worldwide. It's also a great occasion to announce to all of you that we are having a partnership and that we are joining the Biotech Dental family on January 1st. But we will do more webinars and more communications about that. But even though he's mostly known for his work on aligner system, he's also teaching and practicing pediatric orthodontics at La Clinique du Sourire in Paris, that he founded after his postgraduate in clinical advanced orthodontic at New York University in 2001, when I was still pretty young. He developed an holistic approach, mixing orthodontics with an awareness on posturology, myofunctional therapy, osteopathy, TMG, sleep, and occlusion And he was putting all of that together to develop a unique approach that will be also one of the subjects of the webinar of today. So last but not least, his presentation is today going to be really focused on not all his work, but this part of the protocol on how to naturally include the myofunctional therapy on aligner treatments. Many people could consider that it's two parts of orthodontics that do not well belongs together. Now Arash is going to show us in the next 45 minutes why it is absolutely untrue and why they are actually the best friends. Froggy mouth plus aligner treatments, it's right now. I let you start, my friend.
Thank you very much, Guillaume. I'm very pleased to be here, my friends. Hello, everyone. It's so nice to be able to talk to so many people around the world. And that's one of the main advantages that we have now with those techniques and Zoom and everything. So I'm very pleased to have this little, maybe short talk and chit chat with you about how to use and implement some myofunctional therapy and, of course, the froggy mouth in your everyday aligner therapies and treatments. So I won't talk about how the froggy mouth worked and what is the function and the science behind the froggy mouth, because I believe that most of you know already about it. Um, Briefly, it's a subconscious um, technique or device to inhibit some false and incorrect function of the lips and allow patients to use other ways of placing their tongues and their occlusion to have a better swallowing. So I used the froggy mouth for years, maybe more than 10 years now, on kids and infants. And that was the first purpose of the froggy mouth at the beginning. And if maybe a few years back, 2, 3 years, it's not a long time ago, we started talking about why we don't use this on adults, because obviously it's a very easy to use, everyday use device. And adults spending now at least some minutes, let's say hours, on Netflix or I don't know, computers, PCs, and everything. It's quite easy for them to have a little device in their mouth and just use it for 15 days, 20 minutes, 15 minutes or 20 minutes, sorry, every day. So let me share my screen and disappear from here. Yeah, so I hope everyone can see this. Okay, hope everyone is seeing my screen now.
We don't see yet.
Okay, you can see it now?
No.
No. Let me share it again. Strange. Share. Okay, say no, I don't want to share. So let me go out.
Don't worry. Ah, right now
Good,
we are seeing it. Yes.
good. Okay,
Perfect. Let's
perfect.
go.
So I was telling that it's a quite easy to use um, device on adults. As you can see here, this is my patients using, adults using now froggy mouth every day. So it's a very easy to use device. It's quite comfortable. And when they understand why and how to use it, it's quite easy for them to do it. So the main thing today in this 40 minutes talk is to understand that this is not a magic. This is not magical. It's just something that helps some of our treatments not only to finish correctly, but most of all for me to have a better retention and stability over time. Because when you have a tongue dysfunction and a muscle dysfunctioning on adults, it's very difficult to do some re-education afterward. And a lot of patients don't want to go to physiotherapists and do a lot of tongue re-education and things like this. And having a quite easy to use device, only 15 minutes a day, it's better for them. And we started having really nice results with this. So the thing to understand is how to use it and when on the treatment, because by itself or at the wrong moment, using the right device at the wrong moment doesn't help. And using the wrong device at the right moment doesn't help either. So here we have to use it. It's the right device, but we have to use it also at the right moment. So when we are doing our diagnostics, of course, we look at our 6 degrees of freedom that we have with the jaws and teeth in the 3 dimensions. And most of the time, when you have dysmorphosis in a human, and adults are more difficult, of course, you will have some difficult issues with most of the time the upper jaw, the maxillary. And these transversal, vertical or sagittal anterior posterior problems and issues are very, very, very often related with the tongue position. So there's an intelligence in programming the right movement to do with your aligner sequencing and orthodontic treatments, and the tongue to reposition and re-educate for a better placement. So if I show you a very classical little movie, you will see that when the tongue is not correctly positioned, and most of the time it's in a down, lower position, and going on forward and having a thrust and sucking between the teeth, you will have some problem appearing on a young age, and mainly you will have a transversal problem. So let me stop here, because I'm a maniac. You should know that I'm a maniac, and I'm a maniac with the upper jaws. And one of the things that I work on from the very young age, that means 3, 4 years old until 93 or 94 years old, there's no age for this, is this upper arch form. And it's difficult when you have an adult to understand if this is because the tongue didn't do its job when he was a kid, and then the jaw, as you saw here in the animation, is becoming, because of the outer jaw and muscles force going inside, inward, and having these kinds of shape. Or it's because of cranial dysfunction and torsions that osteopaths and chiropractors know very well about, that are going to lead to a incorrect arch form of the upper maxillary. So when you're facing an adult, that's not the main issue, because anyway, the arch isn't correct and you have to modify it. So that's the first thing that we will do in most of our treatment planning when we have a tongue positioning problem. And you could send these kind of patients to hours of physiotherapy, re-education, everything you want. It won't work. It won't work because there's not enough space on the upper arch. The ceiling, the house, the cover, call it anything you want, but won't be able to accept and welcome the tongue in the right position, upper and right position. So this is one thing that we will see, because most of the open bites, for example, that are the classical cases when I use the froggy mouth now, have this problem of transversal dysfunctioning and narrow arch that we will have to reshape first, and then we can use any device we want. And here we will use, of course, the froggy mouth to re-educate the tongue and allow it to have a better position. So first problem is the narrow arch and the shape of the upper arch. But as time goes on, from childhood to adults, there are some other issues that will appear over time, because the tongue positioning will create some problems in between teeth, some extrusion on the anterior teeth, on the lower jaw, and some attrition and destruction and worn on the back teeth on the patient. And this warning and this attrition of the posterior teeth, molars and premolars, will lead to a loss of vertical dimension. And when we are losing vertical dimension, most of the time, the lower jaw will go backward and start creating TMG problems and disc dysfunctions. So you got TMDs related to tongue positioning and loss of vertical dimension and the jaw going backward. So this is the second reason why I will use some myofunctional device and Froggy-Mouth to re-educate the tongue positioning all together with the vertical dimension repositioning and lower jaw repositioning of the patients with orthodontics and very often with prosthetics and overlays or any device or any uh, prosthetics that you can use to give back the patient the vertical dimension that he needs to correct his TMD and to help him get rid of those symptoms and pains that we have. And all these problems will lead to a head syndrome in a forward head positioning syndrome. That is another problem and the postural problems, as you can see. And those patients start having back problems and neck problems related also to their tongue position. And again, osteopaths and chiropractors know this very well, and they are working with us because when they have this kind of cervical spine problems, most of the time they have a look at the jaw positioning, arch form, and tongue positioning because we learn them to do this. And they know how to look at this. And so it's a multidisciplinary problems that we have. So when you look at a mouth and you see this tongue thrust and the sucking of the tongue 2,000 times any 24 hours, of course there is a problem. And the main first problem that we have is the expansion problem. It's the arch form problem that you can see on this lady at 27 years old. She has a problem of a transversal problem on her upper arch. And then the tongue thrust is creating a protrusion of the anterior teeth. So we have a lack of expansion on the back, canine to canine or molar to molar, and most of the time, a protrusion maybe just of the upper anterior teeth or both upper and lower teeth. And finally, we have a problem of intrusion. So the protocol that we use on this patient is first to reshape the upper jaw, then to do a retrusion of the anterior teeth, and lastly, to do an extrusion of the anterior teeth and maybe an intrusion of the posterior teeth, which is very classical in orthodontics. But here you can see that this tongue thrust and bad positioning will create what I was talking about, the forward head posture. And the forward head posture will create a hip posture too. The sacrum is going forward too. So it's a very classical and specific posture of people that you can see when they have a bad tongue positioning. The tongue being related to the whole posture. I don't have time to talk about the tongue muscles and all the joints that it will follow up to the toes, really. So what we're going to do in my office, we're taking care of the human posture, the patient posture, as all along when we are doing the orthodontic treatments. And we do this for kids, of course, but we're doing this for adults too. And sometimes they come for orthodontics or aesthetic reasons because they don't like their open bite. And we are to explain them that maybe they have back problems, back pains, neck pains, or bad posture or digestive problems that are related to their open bite and tongue positioning. And when they understand, of course, they are eager to go to a complete treatment and have a complete head and neck and body and, of course, jaw treatment. So I don't have time to talk about this, but it's just to explain how we are taking care of our patient in a holistic and integrative, complete way. But on a purely orthodontic and digital orthodontic, that means with aligners, what we're doing is always the same kind of protocols. So with this patient with these nice open bites, and by the way, I'm talking about alveolar open bites, of course, not skeletal ones, because obviously when you have a skeletal problem, you will go through surgery. And that doesn't change the end of it, because even with the surgeries, we will have to change, of course, the upper arch form and replace the jaws and replace the tongue. So we will use the same protocols more or less with the froggy mouth when we do surgeries too. I won't talk about surgical cases today, but you can understand that the idea is the same, yes? So this very narrow upper arch is not allowing the tongue to go in the right position. And if you compare this upper arch, the lower arch, there's something wrong with the size, of course. So the first thing that we'll do, and this is very important to understand, is to change the arch form and the intercanine distance before going to any re-education and myofunctional treatment. So we are going to program and do the staging first to change the arch form. And when the arch form is changed, then we will do some retrusion if need be. And finally, eventually, we will do the extrusion on the anterior teeth. And you can see that you saw a change of arch form, of course, on the upper, but on the lower arch, you won't see anything very clear on this view, on the occlusal view, maybe apart these little spaces here closing, because there was a protrusion on the lower teeth also, of course. But when we have a look on the front side, the frontal view is very clear. Look at this canine going outward and creating space, and then protrusion, and now we're starting the extrusion. So extrusion is coming last when all the other problems have been solved. And you will see that now we can even treat the root inclinations with our softwares, which have enormously evolved these past few years. And this has always been very, very efficient. Yes, and when you look at the result, maybe 16 to 18 months later, she has a very nice smile, open bite is closed, she has a nice occlusion, everything is fantastic. And you have a very, very, very nice and more adapted upper arch form, of course, correlated to the lower arch, and a better smile, better function, better everything. And the patient is very happy with this. But the problem we had for years was the retention then, because with adults, we are not easily correcting all the parameters that created that open bite. Of course, being the tongue, but the posture, head positioning, swallowing, breathing, chewing, everything that created that open bite is still there after just orthodontics. So just orthodontics is not enough, and you have to put very, very strong retention after that, and even strong retention are not enough. So these patients had that problem of stabilization of the treatment afterward. So that's why we started using froggy mouth first to help the closure of the space of the open bite, and then help the stability of the occlusion, very strong occlusion because of the work of the froggy mouth, and of course a better tongue positioning with working with osteopaths or a physiotherapist or any specialist of the tongue or muscles that can work with the patient afterward. Now we have a really good understanding of how it's working, and with those software that we have, and I'm using the NemoCast software from Nemo Studio, which in my opinion is largely the best software available in the world. And you have so many possibilities with the software, but just look at the root segmentation and the way we can work on patient when we want to close and open bite. Sorry. And for this, we have to look at how we're going to change the root positions before starting the extrusion. So if you look at this canine and those lateral, look at the difference that we can see. Let me use it like this. Before we do this, look at the work we do for expansion, root parallelism, and when the roots are really straight, then we can go down. And this is very more efficient than going down like this, because when you look only at the crown and you don't see the roots, you can start extruding a lateral or a canine, but when you see at the root inclination, it won't extrude easily. You will have some problem extruding this and have problem with your aligners. And people say these aligners are not working. That has nothing to do with aligners. It's just because of the staging and the intelligence that you use to how you're going to do things and what are the sequences. So now we're going to first, you see this different inclination of the root we have. So now the canine and all the teeth can go down all together. So you can go and do extrusion on several teeth together if the roots are parallel. And now it's going down. Okay, you see? And that's the moment I choose to use my Froggy with patients, because I need to have a correct upper arch form, a correct root inclination, and then I start my extrusion on the sequencing. And the staging will start here, and the Froggy mouth will start here, yeah? And of course, we have nice rendering now and 3D views of the smile for the patient. They like that, but it's just um, for a lot of little details that we can use here, because we can look at the relation between the lips and the smile and the extrusion that we did, but it doesn't change the protocol by itself. Here it is. This is a classical staging of Nemocast. And you can see what I did. I put all the 5 other movements first. That means torque, rotation, tipping, of course, protrusion, etc. And then I postponed all the extrusion here. So there's a gentle extrusion on the upper and lower arches that you can see. And here at this step, step 23, is when I will start using the Froggy mouth with the patients. It doesn't have any sense before, and it's a very long time anyway, because here he has more than 20 aligners coming. That's more than a year. So most of our patients are wearing and using the Froggy mouth for 6 months to 1 year before the end of treatment. And then they use it again for 6 months after. So it's almost 1.5 years that I use sometimes 1 year and sometimes 1.5 years that they will have this Froggy mouth. And that's why it's so efficient. So you have to use it at the right moment and for the right amount of time. And 6 months to 1 year is the minimum, in my opinion, and experience is the minimum. Here's another one. Look at these beautiful cases that you can do without surgery now, using the right staging and the right devices and the right multidisciplinary treatments on the patient. So it's the same for her. So we're going to do the same treatment, but we will add some, of course, class 3 elastics and lower distalization on her treatment. But look at the arch form. The upper arch is not allowing the tongue to go up. So the tongue did go down for years now when she was a kid and push down and forward the lower jaw. So if you want to close the open bite and pull back the lower jaw to correct the class 3 she has, we have first to modify the upper arch form and then use some device and myofunctional treatment to re-educate the tongue and prevent the tongue to thrust forward and push the lower jaw forward and keep this open bite. So if I go, let me just share another. How can I do this? Oh, here. Let me share my. Okay. All these. Sorry. Okay. Here, can you see this? If you, this is a
Yeah.
classical window of the Smilers viewer that we call the Smile setup, and you can see the patient I show you and how we're gonna program and stage the movements. And look at this. First of all, I will do the arch shape modification. Okay, that will take a while, and then we add the extrusion attachments and we start the extrusion on a second hand. So that's why when I will start using the Froggy mount. And if you look on a lateral view, you will see that the lower jaw will start moving at some time when we are programming the elastics. So you can see that we are leveling first. We are leveling the spay curve and the arches. We are modifying the arch form. And then here, we start to pull back the lower arch, putting elastics and closing the space. And here I have to control the tongue, because if my tongue is fighting with the system, it will be very difficult. So we are using the Froggy mount at exactly this moment. And then, as I was telling you, for 6 months later, after the end of the treatment, she will have her Froggy mount to use again. And if I show you the timeline, which is the staging, you can see again that my staging has put the extrusion for the lower and upper arch after the other treatment has been correctly and in an intelligent way staged. And then here I will add some attachment and my elastics, because here you will see the maxillar mandibular intermaxillary relationship changing with my intermaxillary retractions, which is the class 3 elastics. So this is a very, very efficient and great software when you can do a lot of things like this, and having all the 6 movements for any tooth. If I open a box here for any tooth, you will see different kind of movements: mesialization, protrusion, rotation, etc. And all those, you can see the speed and the moment we're gonna stage them and when it starts. So here the extrusion will come after, and I will start my elastics here at stage 17 and my extrusion on the upper here at stage 21. So for this patient, she will start using the Froggy mount 15 days a week here at stage between 17 and 20, let's say. And so that's for a few months, 6 to 8 months, and then she will keep using it for a year or 6 months afterward. So afterward, it would help to maintain this nice occlusion. So if I go back now to my patient, are you seeing this again, or I have to
Yep,
share
we
it
see
again?
it. We
I
see
have to share
the
again?
no,
Yeah.
we see the Dento Smile in Nemo Cloud right now.
Ah, so okay, wait. We cannot share 3 things together.
Tu dois refaire un nouveau
Okay,
partage
so I
d'écran si
go
c'est un
back
autre fenêtre.
here.
Ouais.
I'm back on the keynote now.
Yeah,
Yeah.
you are.
Okay. So now if you look at my patient, here she is. And look at how she has to struggle with her swallowing when she has the Froggy mount. This is very easy to use for her. It's very, very comfortable. It's just 15 minutes in front of a screen, computer, and it's very, very comfortable every day. And look at that. Look at the result we have on the arch form, the class 3 reduction, and it's not still finished, and the lower arch form. So this is crazy. It's just with aligners and elastics and the froggy mouth, nothing more. Of course, we had a chiropractor working on her head, but and body, but that was it. It was the only thing that we used. And look at the smile change and the space closure and the occlusion. Everything is very, very wonderful. And you can see her profile change after 2 years. Look at this, without surgery, just with an intelligence used on everything in a more holistic way, posture, tongue repositioning, and of course, aligners and good staging of the treatment. So briefly, the other reason why I use this is for this kind of treatment. I'm doing a lot of TMDs treatment and postural treatments. And with this patient, if you look at her teeth and destruction she have, the attrition she has on the back teeth, and you can see how the tongue has pushed the lower incisor forward. And now she has a very difficult contact on the anterior that is destroying her teeth and her periodontic. And we have to close the space, of course, and rebuild a good vertical dimension. So how can we do that? It's very difficult, of course, when you don't have the right tools and right understanding of the system. So what we do now is, I will go briefly over this, but it's very interesting to understand how we work with Nemo, because we have a way of superimposing the patient's photos, CBCT, and impressions, of course. And we will use all these to, with some jaw tracker that we use. I use the Mojo, very classical. And you see that we have a virtual articulator in Nemo that is the anatomical, biological articulators, when we can have some calculation of the intra articulation compressions. And the pressure and the compression that we can see on the software allow us now to replace the mandible, calculating the right positioning of the condyle inside the fossa. And over the years, we realized that this was a very, very reproducible and great way of repositioning mandible and finding the right vertical dimension of people. Of course, we mix this with some spine and body treatments and myofunctional treatments. But the main problem that we had as orthodontics or dentists was to find the right amount of material that we had to add on the teeth. What is the right dimension? And this tool gave us a very, very nice mean to do it very, very easily now. So you can see the difference on the compression because we have a color code. And the code here, when you have, for example, red traces like this, is because you have a bone-to-bone contact and you have no place for a disc, and there's a lot of compression on the joint. So when we decompress this, it's changing the jaw positioning on the software. And you can see here that we open the space on both sides. And the result was, of course, we have the right vertical dimension now, but we also have a crossbite on the front now. So now we will save this position, and the patient will wear some splint that we create on this position on Nemo and we print at the office. And she will wear these splints for 3 to 6 months minimum and have her chiropractic or osteopathic or physiotherapeutic treatments, sometimes different things, autopsy, or sometimes she will need something on her shoes or whatever, but she will have the whole treatment and pain management treatment before we can go forward. But when we did this, then we have to transfer the position to orthodontics because I don't want to lose this space. So my problem was solved by adding some snap-ons and mock-ups on the treatments and transferring the position to the orthodontic treatment. So we're going to transfer this new position here because we save it on the same software, which is Nemo, from Nemo Fab that you can see here to NemoCast. And you will have it here. So now you can see that the position is changing on the orthodontic interface. So we will do now the staging and the treatment planning for orthodontics, of course, closing the anterior space. And you understand that retruding the lower anterior incisors will diminish the lower space for the tongue. So that's the good time to re-educate the tongue and help it go upward. And I will need some space closure on the back and a strong occlusion, but on the right vertical dimension. So we are going to do this little and easy correction, orthodontic correction, which is not a big deal. But then you will see that on the same software, I'm going to add some overlays. And these are temporary overlays that we will add on the patient mouth with some snap-on and template, which is very easy to place, 15, 20 minutes. And the patient will keep these overlays for 3 to 6 months again, before going to the permanent ones. Here, you can see that we add those on the orthodontic treatment plan. And we have the right positioning of the vertical dimension and the mandible, the right anterior relationship, the right alignment, everything is okay. And after that, she will have upper veneers from premolar to premolar and the lower permanent overlays. So this is a mock-up model that we printed at the office, and you can see here the overlays and the correct anatomy of the teeth on the lower jaw. And we will create a template, the splint, which the dentist will fill with the composite. And this is very easy to use because it's just composite filling, and with the template, you can't have any error, any mistake. Look at this, it's very easy to put. So this we call this a snap-on. Of course, it's a shell. And you just have to put the shell on the mouth and do your light treatment here. And then you have all of a sudden 6 new overlays in the mouth. And we're going to correct the occlusion contact points and be sure that the patient is comfortable. And she will have 3 months of use of these, eating, talking, and doing everything she wants to be sure that her jaw is okay. She doesn't have any pain coming back, any symptoms, and she's still comfortable with her jaw, her joints, and her back before going to the end of the treatment, which in her case was adding some upper veneers and lower permanent overlays. This is the temporary overlays you can see with the good adaptation with the upper jaw. And by the way, look at the closure of the spaces we had at the beginning on the lower jaw. You can see that orthodontics and this work very good all together. And that's when she used her froggy mouth, and that's her using it. You see again, look at the pressure she has here. Look at the work the muscle have to do to readapt. And she has to, because the lips are inhibited, she has a very strong pressure on the teeth, and the tongue has to go back. So that's why it's stabilizing our treatment and helping maintain a good result. And here she is with her upper veneers, lower permanent overlays, and final result with the veneers and the position. And you can see that she has a very nice result with the occlusion. And this is because we had, again, a holistic and complete treatment planning from the beginning. And that's why we had a very, very nice stability of those treatments. So here it is. It was very short. I know it's difficult to talk about a lot of things, but I wanted you just to understand how I use and share my experience with with this kind of treatment. And the two main treatments when we use this device, the Frogger with the open bite and transversal problem and the vertical dimension and mandibular repositioning. So hope you appreciate, and of course, I'm listening to any question that you can have.
Thank you so much, Arash, for this wonderful presentation, and thank you for all your attendance from the beginning till the end of the presentation. There's only two people that disconnect from minute one until the end, which is a great evidence of how interested we are people on what you had to tell them. So, as explained, we're gonna have a 15 minutes question and answer sessions. Feel free on the chat or on the Q&A part to vote for your favorite questions to make sure that I'm gonna ask them. So we're gonna start directly with a question of Sofia. I'm so sorry, but I'm not confident enough to say the last name without making any pronunciation mistake. So she's saying, I have a question. A 20 years old girl patient came to me in whom I discovered an infantile type of swallowing. 5 years ago, she had orthodontic treatment, but at the moment her lateral incisors have started to deviate vestibularly relative to the dental arch. Please tell me whether the appliance will be effective for this age and how much time will it take to change the habit?
Well, I believe you saw that it will be, yes, efficient at this age or at any age. But in my opinion, you should look at the upper arch form because most probably you have a transversal problem now and a bit of a relapse after her orthodontic treatment. If they did a nice reshaping of the maxillary, maybe not at the beginning, but maybe you had some relapse and the upper arch is a bit narrow now and the tongue is thrusting forward again in, as you said, infantile swallowing and pushing on the scissors. So yes, you can use the froggy mouth and some orthodontics to correct this, but first you should correct the upper arch shape and the occlusion, having a very stable occlusion on the back if you want it to be stable over time. But of course, it will work, yes.
So she was continuing the same question, saying that she plans to treat this defect with aligners, but it is much easier than an open bite. So she thinks that she will first use Froggy-Mouth and after melting the swallowing, install the aligners. I think that it's a very good question that you partially answered during the lecture, which is always what's the right moment to start to treat the tongue dysfunction while you are using the aligners.
Yes. So my advice is to take care of the upper arch again shape first, because if the upper arch cannot welcome the tongue on the right position, it will be very difficult. So you will lose your time and your patient will use her time or his time using any device, not only the Froggy Mouth, but there are other devices on the market, of course. But you should take care of the upper arch form first. So you probably need to do a bit of orthodontic first. Then you can stop, do the Froggy Mouth and come back to orthodontics or do as I did on a longer treatment planning, but then on a first step, doing the arch form and a second step, closing the spaces and doing the Froggy Mouth.
So yeah, if I summarize well, and you stop me if I'm mistaken, so you first look at the shape of the upper jaw. If there is enough space, you directly start, and if there is
Yes,
none, you start to make a little bit of expansion with the aligners before starting. And
exactly.
second
You
part
understand?
of the second part of the question could be, when are you then stopping? What is giving you the insight that it's okay, we can stop using the device or decrease the use of the device?
Well, honestly, I don't have a right answer for this because we are still are very young using the Froggy Mouth on adults. Now we just ask them to do it 6 months after the treatment. It's just a guess, okay? and we have good stabilization up to now after 6 months, and people are getting bored anyway.
Mm.
So even if you don't tell them, some of them won't go the over 6 months. Some won't even do it 6 months, because when they have the result, and this is human, when they have a nice smile, the open bite is closed, they forget about everything. So
Mm.
it's important to have them come back to the office and check with them if you have a little relapse, asking them if they're using their froggy mouth correctly, and if it's a bit used or worn, giving them a new one. So finding some excuses to make them come back every month or every 2 months for 6 months, because for now it's difficult for me to say it's okay for 6 months or 1 year, or when, because if your result is okay, the only thing that you can check is the relapse problem and the stability. So I used to see a very nice but occlusal stability and relationship after 3 to 6 months. And we had some surgeries done. I didn't talk about surgeries, but we had some class 3 surgeries done on patients. And after surgery, sometimes the occlusion is not completely stabilized and not correct. So you have to do a post-surgery orthodontics, make them wear elastics, etc. And when you use the froggy mouth at that time, it's crazy. They have so much pressure on the back, on the teeth, that the occlusion is taking place very nicely after 3 months, 2 to 3 months. So I would say 3 months is the minimum, 6 months is good, and then we'll see over the years.
That's the point. We're having some patients that no matter the age, were treated in such a short amount of time, while for some people it was lasting 9 months. I even have seen one patient for 12 months, or to say. There's another question that comes back very often in different meanings, but it's always the same points. Um, Many people are asking you if it's actually possible to wear the froggy mouth while wearing the aligners both together. And some people are asking you if you are using also all the devices like the MyoBrace or stuff like that. But I think that it answers also about the main strength of the froggy mouth for that to be able to be worn um, no matter the device you have in mouth.
Of course, it's very complementary. You saw on the videos I showed you, they all had their aligners in their mouth. So it's not a question, they use their froggy mouth with their aligners in the mouth. They never took off their aligners during the day normally, so they can use the froggy mouth with it. It's very nice for that. And if you not if you're using other kind of devices, not the MyoBrace, because MyoBrace and froggy mouth you cannot use together, but you can use the MyoBrace at night and then the froggy mouth 15 minutes a day. So the froggy mouth is complementary with any other devices that you use. I don't use MyoBraces anymore, because on the kids we have built something that is much more efficient with my friend Patrice Bergeron, and these are cubes that we have created on the aligner. So there are other kind of techniques that we use. And on adult, I'm using other devices like the TRP or other things that you can, or lingual and night envelope, or there are other kinds of devices that you can use. But I think the most important thing is to re-educate people, and this is going through a body work too. So it's not just about the tongue and the mouth. You should take care of their posture and their spine, and a good spine will go with a good result. If you don't have a good spine and a straight and quite symmetric back and spine and head posture, it will be difficult to maintain a position even if you use a froggy mouth or any device for months and years. So it's a holistic way of seeing your patient, integrative, and taking care of different aspects of the body posture.
You are receiving many positive comments. One person is thanking you for this elegant presentation. Some more concrete questions are also about how to properly choose the size of the froggy mouth. Because Sophia told us that some lecturer that she was seeing, I'm not sure in which country is it, are saying that they are using most of the time the small sizes. I guess that it's more for pediatric orthodontic. Can you tell us more on what's your little technique to properly choose the size?
Yes, on kids it's different because on kids you can have the choice between three sizes, and most of the time we will look at the size of the lips, of course, and the corner of the lips, and you better use if you have a doubt, you better use the bigger one of both sizes that you want to use. So the small one I use really on little kids, on infants. Most of my patients after 7, 8 years old will go to the medium one, and almost all adults have the large one, and sometimes the large one is not large enough for adults. So maybe you should start building a new one, still bigger for big adults with big mouths, because they can't keep it in place when it's even with the large one. So for adults, the question is not really relevant because you will almost always use the large one. On kids, you have to look at the corner of the lips and the canines, and be sure that they can do the work, and make them wear in front of you and swallow, and see how they can close their teeth on the back and try to swallow with the tongue going back. And if you still see the tongue going inside between the teeth, because when you look at the tongue thrust and sucking between the teeth, normally if you try to do this on yourself and you keep your lips apart, widely apart, and put your tongue between your teeth and try to swallow, you can't do it. Because even with the open bite, if your lips are not doing the job, you have to go back with your tongue and have a pressure on your back teeth. So that's something that you have to look on the patient mouth and ask them to swallow. And if you see the muscles working and the tongue going back and the pressure on the back of the jaw and the masseter is working, then you know that you have a good size and they are not bothered by the size of the froggy mouth, and they don't have to replace it always with the tongue or the teeth. So as I said, on adults, it will be almost always the large one.
Yeah, to complete a little bit the question of Sophia, she was saying that she has a patient with lips that are 5 centimeter wide. When we speak about centimeter wide, it's really without any smile or stuff like that. And for everybody that is wondering, because the point that we often have adults, depending on the countries, depending on the ethnicity, a big difference of the distance between corner of the lips, depending on so many criterion. Gender is actually making such a big difference. I know many adult ladies that needs a small one, with no offense to them, only because when there is no smile at all on the face, there is a small distance between both corners of the lips. So if you have any wondering about that, I ask you to type on our website how to properly choose the size of my froggy mouth, and you will get the exact measurements of every size, and then you will be able, according to every patient, to decide that. It really, really depends on every your patient. You are having,
Now you have, if I have a comment on this,
yeah.
because we are, as I said, still young with using this device on adults, but you said it very correctly. Some people have very big lips, and some ethnies have very big lips and open bites. So the froggy mouth is not working, because in a really, what will be fantastic is to be able to open the distance between the lips on a froggy mouth. So maybe create a froggy mouth with a little screw or something that we can turn and open the space between upper and lower lips. And that would be very efficient for people with big mouth and big lips, because these kind of people, when they put the froggy mouth as it is, it's smaller than the open space between their lips. So it's not very efficient. They can push with their lips on the froggy mouth, and it's not keeping the lips open. So maybe in the future you can create a adaptable froggy mouth with a little screw or something that you can open the space between the upper and lower lips. I don't know.
Mm. It's a good idea to take her into account. To jump on one subject to another, there is a beautiful compliment from Myofunctional Solutions that is saying that it's a fabulous presentation and that she understands much more about how to correctly use the aligners in parallel with the myofunctional therapy with an excellent imaging and treatment planning can achieve excellent results. And she's saying that as a myofunctional therapist who is using Frogimouth with most of the patients, it's very useful to see also your point of view. That is leading me to a question that is very important, in my opinion, when you work with adults on aligner treatments. How are you speaking to the adults to explain them about the importance of having a myofunctional rehabilitation with the aligner treatments to maintain the results? What's your little tricks to be able to increase their compliance?
Well, for example, with the open bites, it's very easy to explain to them because, first of all, most of them had already had orthodontics when they were teens or young, and they had a relapse. So they know when they come, they know, yes, I know it's my tongue. And they already told me, and so they know they have knowledge about their tongue problem and positioning. And you can give them a mirror and ask them to swallow and say, look at your tongue is going between your teeth. And if you want to close this, there's a problem with that. There's an intruder in between your teeth so that it won't close. Or if we pull very hard with orthodontics, we're going to close it, but then afterward it would relapse because your tongue, and I explained them, your tongue is related to your head posture, your body, your swallowing, and it won't go away just because we close the teeth. So we have to change your arch form, your close the space, but you have to re-educate your tongue if you want it to be stable. And they understand very well. And because the device is very easy to use, they can do it. I mean, it's very gentle and it's discreet. They can do it on their computers or watching a movie nobody sees. So it's quite easy to make them do it. That's not difficult. For other
But
kind of
always
problems,
maintaining the horizontal look for what they do, because just on their computer stuff like that, we always have to be careful to not be drooling like that, because otherwise saliva is falling.
yeah, okay. But anyway, and for the other kind of problem, like the class twos of tooth attrition or the vertical dimension, it's just question of explaining. You can show them the little video I showed you. It's on YouTube. It's easy. Say, look, when you have a tooth destruction like this attrition, when they're worn out, it's because your tongue is not well positioned. You can show them how they are chewing their inside of their lips or their cheeks and show them how it works and then explain to them again if they want results and stability they have to use something to re-explain to the tongue how to work, and that's why they have to do some work outside orthodontics and dentistry in their body and in their muscle and explain them what a myofunctional therapy is. So if they come for this, it's easy, but if they didn't come for that, you have to explain them how it works and the why and the how.
That's I think, one of the most important points. One last question before that we have to let everybody have her dinner. Uh, Very important. What are you exactly looking at on a patient when the patient is entering and telling you, hey, doctor, I need to make aligners because I have this or this problem? What are you looking at on the patient to assess if the patient needs a froggy mouth or not? Because when we have an open bite, a big tongue thrust, it's obvious for everybody we are needing a myofunctional therapy. But some other deformation also needs it, and especially that it's not linked to the deformation, but really to the potential dysfunction. And so what are you looking at on every patient to be able to make this diagnosis?
Well, on adults is what I said at the beginning. I look at the six movement on the three directions, and I'm used to look at their crane torsions and bodies too, and their neck. and the way they swallow and talk. And I ask them question about if they snore when they're sleeping, if they have apnea, if they are tired when they wake up in the morning. And most of those people are sleeping with an open mouth. So this is one of the reasons why you can use the froggy mouth too, because when you have a bad breathing, you almost every time have a bad tongue positioning going all together. So if I have my main look is at the upper arch. So I have in any direction the upper arch having some problems, vertical problems, transversal or sagittal problems. I will have a look at the relationship between arches, the tongue positioning, the mouth breathing or not, and the head posture. And if I have a class 2 or class 3, strong class 2 or class 3, probably I will have a tongue positioning problem. If you have a crossbite, probably you have a tongue positioning problem. Of course, open bites, anterior or lateral open bites, you have a tongue positioning problem. And if you have to rebuild prosthetics or vertical dimension, you have to re-educate the tongue. So in a way, you can say that as long as you have an upper arch or arch relationships, maxillary relationship problems, the tongue will have to be re-educated. If the problem is light, the tongue will re-educate by itself, just with retentions, and start having new behavior because it was a very light dysfunction. But when the dysfunction is growing harder and harder, then the tongue positioning, and with age, of course, and years, it's crystallizing and becoming more and more difficult. So that's some of the things that I look upon.
That's, I think, very important and interesting to mix the different ways of making diagnose on watching the formation, watching how it moves, and also asking questions. I think that when we want to properly assess, it's really important to always remind that there's all those different levels of questions to ask to each other as a practitioner, and then also to ask your patients. I'd like to especially thank you, Arash, for this wonderful lecture, especially that we had finally at the end one French comment to congratulate you
Oh,
from Dr. Marquet in France. So I was worrying to only see English comments. I'm glad that we are also there and that there's also the French practitioners there. Thank you so much. Thank you so much also to all the attendants that took their time like that on a Monday evening or afternoon to listen at everything that we had to say. It was a great honor to have you, Dr. Zarampour, here, and a bigger pleasure also to have you. I just make a little advertisement break before the end of the webinar. I think that you are seeing right now and Froggy Mouth website with the next webinar like that is going to be organized. As you know, we are Froggy Mouth Mother Company proposing every 2 months a new wonderful lecturer that can come to share his opinion, point of view, protocol like Arash did today. In couple months, it will be Dr. Natalia Maklinets. I'm so sorry if I'm making some mistakes on the name that is coming from Ukraine that we're having a deep thoughts for the moment. She's an associate professor at the university, and she's going to present us a wonderful lecture about the atypical swallowing and its correction in daily orthodontic practice. Even more that Natalia realized a wonderful clinical scientific study on the efficiency of froggy mouth, bringing the light on something that I often speak about, making the difference between patients that engrammed the right functions, which means that they are able to swallow properly, able to breathe properly, and the automation, which means that those patients breathe properly, swallow properly, but without being aware that they are doing something special. As we always say, automation is the key and the therapeutic goal that we should all have for every treatment. So she's gonna present us a wonderful presentation, plus the results of her clinical studies, making this very important and beautiful difference between both. You are in the Froggy website right now. You have the link on the chat, and you can directly register right there to be able to attend the lecture. I'm sorry for this little advertisement moment, but it's important to promote the qualitative scientific content. So thank you once again, Arash, for all of
Thank you
that,
very
and
much.
I give
Thank
you
you.
the
Thank you,
word
everyone.
at
A
the
big
end.
hug and greetings to people from Ukraine, of course. And go and listen to her. It's great for you to be here. Thank you very much. Thank you, everyone. And hope we can meet one day in person, in real. But thanks to the virtual world to make us share and have these moments. Thank you, Guillaume.
Thank God that these are internet. I love internet.
Yeah.
Thank you so much, Arash. Thank you for your time, and thank you, everybody. We see each other in the next virtual congress, and feel free to ask all the questions that couldn't be answered today on social networks or directly by email. Ciao, ciao, everybody.